The focus of this care plan is on the supportive care rendered by family members, significant others, or caregivers responsible for meeting the physical or emotional needs of the patient. Caregivers have special needs for knowledge and skills in managing the required activities, access to affordable community resources, and recognition that the care they are providing is important and appreciated. Caregivers can be considered secondary patients who are at high risk for injury and adverse events. Caregiver role strain is the difficulty in performing family caregiver role for a patient. Caregiver role strain related to care receiver health status, illness severity or chronicity, unpredictability of illness course, instability of care receiver's health, increasing care needs, dependency, problem behaviors, psychological or cognitive problems, addiction, substance abuse, codependency. Caregiving activities. Discharge of family member to home with significant care needs, example premature birth, congenital defect, frail elder post-stroke. Unpredictability of care situation, 24HR care responsibilities, amount or complexity of activities, years of caregiving. Ongoing changes in activities. Caregiver health status. Physical problems, psychological or cognitive problems. Inability to fulfill one's own and others' expectations, unrealistic expectations of self. Marginal coping patterns. Addiction, codependency. Socioeconomic. Competing role commitments. Alienation or isolation from others. Insufficient recreation. Caregiver's personal and social life is disrupted by demands of caregiving. Caregiver feels care is not appreciated. Caregiver has no respite from caregiving demands. Caregiver, care receiver relationship. Unrealistic expectations of caregiver by care receiver. History of poor relationship. Mental status of elder inhibiting conversation. Presence of abuse or violence. Family processes. History of marginal family coping or family dysfunction. Caregiver has multiple competing roles. Caregiver's time and freedom are restricted because of caregiving. Resources. Inadequate physical environment for providing care, example housing, temperature, safety. Inadequate equipment for providing care, inadequate transportation. Insufficient finances. Inexperience with caregiving, insufficient time, physical energy, emotional strength, lack of support. Lack of caregiver privacy. Resources. Deficient knowledge about or difficulty accessing community resources, difficulty accessing formal assistance or support, inadequate community services, example respite services, recreational resources. Caregiver has knowledge deficit regarding management of care. Inadequate informal assistance or support. Caregiver is not developmentally ready for caregiver role. The subjective data include caregiving activities, apprehension about possible institutionalization of care receiver, the future regarding care receiver's health or caregiver's ability to provide care, care receiver's care if caregiver unable to provide care. Caregiver health status physical. Gastrointestinal upset, weight change. Headaches, fatigue, rash. Hypertension, cardiovascular disease, diabetes. Caregiver health status emotional. Reports feeling depressed, anger, stress, frustration, increased nervousness. Disturbed sleep pattern, sleep deprivation. Lack of time to meet personal needs. Caregiver health status socioeconomic, changes in leisure activities, refuses career advancement. Caregiver care receiver relationship. Reports difficulty watching care receiver go through the illness. Reports grief or uncertainty regarding changed relationship with care receiver. Family processes, reports concerns about family members. Caregiver expresses apprehension about future regarding own ability to provide care. Caregiving activities. difficulty performing or completing required tasks, preoccupation with care routine, dysfunctional change in caregiving activities, caregiver health status physical, rash, hypertension, cardiovascular disease, diabetes, caregiver health status emotional, impatience, increased emotional lability, somatization, ineffective coping, caregiver health status socioeconomic, low work productivity, withdraws from social life, family processes, family conflict, caregiver verbalizes anger with responsibility of patient care, caregiver worries that own health will suffer because of caregiving, caregiver states that formal and informal support systems are inadequate, caregiver regrets that caregiving responsibility does not allow time to meet personal needs, caregiver expresses negative feeling about patient or relationship, caregiver neglects patient care, caregiver abuses patient. The caregiver will identify resources within self to deal with situation. The caregiver will provide opportunity for care receiver to deal with situation in own way. The caregiver will express more realistic understanding and expectations of the care receiver. The caregiver will demonstrate behavior or lifestyle changes to cope with or resolve problematic factors. The caregiver will report improved general well-being, ability to deal with situation. The caregiver will express satisfaction with caregiver role. Caregiver demonstrates competence and confidence in performing the caregiver role by meeting care recipients' physical and psychosocial needs. Caregiver reports that formal and informal support systems are adequate and helpful. Caregiver demonstrates flexibility in dealing with problem behavior of care recipient.